Hello, everyone. My name is Dr. Samara White, and I'm a pharmacy resident at Buffalo Psychiatric Center. Today, we're going to be talking about sleep, insomnia, and the related medications. In this video, you'll learn about what sleep is, what the different stages of sleep are, why sleep is important for your health, how you can sleep better without using medications, and then we'll talk about insomnia and the medications that are used to treat it. First, we're going to have an expert, Dr. Walker, talk to us about the different stages of sleep.
Sleep is perhaps the single most effective thing that we can do each and every day to reset the health of our brain and our body. And by understanding a little bit more about what sleep is, perhaps we can get the chance to improve both the quantity and the quality of our sleep. So, exactly what is sleep? Well, sleep, at least in human beings, is subdivided into two main types. On the one hand, we have non-rapid eye movement sleep, or non-REM sleep for short. But on the other hand, we have rapid eye movement sleep, or REM sleep. And non-REM sleep has been further subdivided into 4 separate stages, unimaginatively called stages 1 through 4. Increasing in the depth of sleep. And as we go into those light stages of non-REM sleep, your heart rate starts to decrease, your body temperature starts to drop, and your electrical brainwave activity starts to slow down. But as we move into deeper non-rapid eye movement sleep, stages 3 and 4, now all of a sudden the brain erupts with these huge, big, powerful brainwaves. The body is actually recharged in terms of its immune system. We also get this beautiful overhaul of our cardiovascular system. And in fact, upstairs in the brain, deep non-REM sleep will help consolidate memories and fixate them into the neural architecture of the brain. So that's non-REM sleep. But let's come on to REM sleep, which is the other main type of sleep. And it's during REM sleep when we principally have the most vivid, the most hallucinogenic types of dreams. The brainwave activity actually starts to speed up again. It's during REM sleep that we receive almost a form of emotional first aid. And it's also during REM sleep where we get a boost for creativity, that it stitches information together so that we wake up with solutions to previously difficult problems that we were facing. Coming back to these two types of sleep, it turns out that non-REM and REM will play out in a battle for brain domination throughout the night. And that cerebral war is going to be won and lost every 90 minutes, and then it's going to be replayed every 90 minutes. And what this produces is a standard cycling architecture of human sleep, a standard 90-minute cycle. But what's different, however, is that the ratio of non-REM to REM within those 90-minute cycles changes as we move across the night, such that in the first half of the night, the majority of those 90-minute cycles are comprised of lots of deep non-REM sleep, particularly stages 3 and 4 of non-REM sleep. But as we push through to the second half of the night, now that seesaw balance actually shifts over. And instead, most of those 90-minute cycles are comprised of a lot more rapid eye movement sleep or dream sleep, as well as stage 2 non-REM sleep, that lighter form of non-REM sleep. And it turns out that there are implications for understanding how sleep is structured in this way. Let's take someone who typically goes to bed at 10 p.m. and they wake up at 6 a.m. So they have an 8-hour sleep window. But this morning, they have to wake up early for an early morning meeting, or they want to get a jump start on the day to get to the gym. And as a consequence, they have to wake up at 4 a.m. in the morning rather than 6 a.m. in the morning. How much sleep have they actually lost? 2 hours out of an 8-hour night of sleep means that they've lost 25% of their sleep. Well, yes and no. They have lost 25% of all of their sleep, But because REM sleep comes mostly in the second half of the night, and particularly in those last few hours, they may have lost perhaps 50, 60, maybe even 70% of all of their REM sleep. So there are real consequences to understanding what sleep is and how sleep is structured. And we'll learn all about the benefits of these different stages of sleep and the detriments that happen when we don't get enough of them in subsequent episodes.
This is a summary of the sleep stages that Dr. Walker just talked about. Each stage of sleep has unique characteristics, including variations in bodily activity and brainwave patterns. The most important things to know is that the organization of sleep can be categorized by either 1. Non-rapid eye movement, known as non-REM or NREM, or 2. Rapid eye movement, which is abbreviated REM sleep. Within the NREM stages, sources vary if there are 3 or 4 stages, but NREM stage 1 is where the lightest sleep of NREM occurs, and stages 3 or 4 are the deepest stages. Sleepwalking can occur in NREM stages 3 or 4, and dreams occur in REM. And it's thought that REM sleep is important for memory, emotional processing, and healthy brain development. When talking about sleep, it's also important to understand the concept of circadian rhythms. This is basically a biological clock in the brain in which different bodily systems are synchronized with day and night based on how light it is outside. Circadian rhythms are responsible for controlling the sleep and wake cycle. It also regulates body temperature, heart rate, muscle tone, and hormone secretion. And it also influences physical activity and food consumption. Next, Dr. Walker will explain why sleep is so important.
We certainly know that a lack of sleep will actually prevent your brain from being able to initially make new memories. So it's almost as though without sleep, the memory inbox of the brain shuts down and you can't commit new experiences to memory. So those new incoming informational emails are just bounced and you end up feeling as though you're amnesic. You can't essentially make and create those new memories. We also know that a lack of sleep will lead to an increased development of a toxic protein in the brain that is called beta amyloid, and that is associated with Alzheimer's disease, because it is during deep sleep at night when a sewage system within the brain actually kicks into high gear and it starts to wash away this toxic protein, beta amyloid. So if you're not getting enough sleep each and every night, more of that Alzheimer's related protein will build up. The more protein that builds up, the greater your risk of going on to develop dementia in later life. What are the effects of sleep deprivation on the body? Well, there are many different effects. Firstly, we know that sleep deprivation affects the reproductive system. We know that men who are sleeping just 5 to 6 hours a night have a level of testosterone which is that of someone 10 years their senior. So a lack of sleep will age you by almost a decade in terms of that aspect of virility and wellness. We also know that a lack of sleep impacts your immune system. So after just one night of 4 to 5 hours of sleep, there is a 70% reduction in critical anti-cancer fighting immune cells called natural killer cells. And that's the reason that we know that short sleep duration predicts your risk for developing numerous forms of cancer. And that list currently includes cancer of the bowel, cancer of the prostate, as well as cancer of the breast. In fact, the link between a lack of sleep and cancer is now so strong that recently the World Health Organization decided to classify any form of nighttime shift work as a probable carcinogen. So in other words, jobs that may induce cancer because of a disruption of your sleep-wake rhythms. We also know that a lack of sleep impacts your cardiovascular system, because it is during deep sleep at night that you receive this most wonderful form of effectively blood pressure medication. Your heart rate drops, your blood pressure goes down. if you're not getting sufficient sleep, you're not getting that reboot of the cardiovascular system. So your blood pressure rises. You have, if you're getting 6 hours of sleep or less, a 200% increased risk of having a fatal heart attack or a stroke in your lifetime. There is a global experiment that is performed on 1.6 billion people twice a year, and it's called daylight savings time. And we know that in the spring, when we lose 1 hour of sleep, we see a subsequent 24% increase in heart attacks the following day. Another question perhaps is, what is the recycle rate of a human being? How long can we actually last without sleep before we start to see declines in your brain function or even impairments within your body? And the answer seems to be about 16 hours of wakefulness. Once you get past 16 hours of being awake, that's when we start to see mental deterioration and physiological deterioration in the body. We know that after you've been awake for 19 or 20 hours, your mental capacity is so impaired that you would be as deficient as someone who is legally drunk behind the wheel of a car. So if you were to ask me what is the recycle rate of a human being, it does seem to be about 16 hours, and we need about 8 hours of sleep to repair the damage of wakefulness. Wakefulness essentially is low-level brain damage.
As Dr. Walker said, sleep can impact both our physical and our mental health. Our bodies need adequate amounts of sleep for our immune systems, for our heart health, and to help control our hunger, weight, and blood sugar. Did you know that the less sleep you get, the more hungry you are? Other important effects of getting enough sleep are improved mental health and cognition, which means your ability to think and to plan. Getting enough sleep can help decrease anxiety and mental distress, and it can increase our ability to control our emotions, think clearly, and problem solve. So it's extremely important to get at least 8 hours of sleep every night. Next, Dr. Walker will discuss some things that can affect our sleep.
So many of the things that people use to try and help them sleep inadvertently are actually harming and hurting their sleep. Two good examples are probably alcohol and marijuana. Many people will have a little nightcap in the evening and they think that having a drink in the evening helps them fall asleep. It's actually not true. Alcohol is a class of drugs that we call the sedatives, and sedation is not sleep. So what you're doing when you drink in the evening is actually just knocking out your cortex, and you're going into this sedation-like state. You're not going into natural sleep. There are two other problems with alcohol, unfortunately, and I'm so sorry to be giving you this bad news, but firstly, alcohol will actually litter your sleep with many more awakenings throughout the night. And so you won't feel restored when you wake up the next morning by your sleep. You won't feel refreshed. The problem and the danger is that many people don't remember waking up so much throughout the night when they've been drinking. So they don't realize that it was the alcohol disrupting their sleep. They don't put two and two together. The final thing about alcohol is that it's very good at blocking your REM sleep, or your dream sleep, rapid eye movement sleep. And we know that REM sleep is essential for a variety of functions, including emotional and mental health. And so alcohol will actually remove that dream sleep, or it will decrease it significantly, blocking that essential critical sleep. And I should also note, by the way, how essential is that REM sleep? Well, studies done back in the 1980s, some really quite shocking studies, demonstrated that if you deprive rats of rapid eye movement sleep, they will die almost as quickly as they would from total food deprivation. That's how essential that dream sleep is, and it's that dream sleep that you block with alcohol. What about, though, marijuana? Well, unfortunately, the news isn't so great there. A lot of people will again will use marijuana to help them relax and sort of just take away some of that anxiety that's preventing them from falling asleep. And certainly marijuana does seem to hasten the speed with which you fall asleep. But unfortunately, marijuana, like alcohol, but through actually a different biological mechanism, will also block your dream sleep. And if you're not getting that critical REM sleep, you can actually become more anxious, even more depressed the following day, and therefore people start to seek out more marijuana to sort of medicate those symptoms that the marijuana is causing because of the sleep disruption. So the advice right now is not to think of marijuana as a sleep aid. One of the other common aspects of marijuana is CBD oil, which is the non-psychoactive component of marijuana. THC is the sort of psychoactive part of marijuana. CBD, which is an oil that people use, a cannabinoid. Those studies have not been really done in a particularly detailed way, but from what we can tell from the limited data, CBD, the non-psychoactive form of marijuana, actually doesn't seem to impact sleep. So probably a little bit too early to make the definitive claim, but at least that seems to be the emerging story for CBD. So what happens if you've pulled an all-nighter or you've had a short night of sleep? Maybe you went to bed too late and you need to wake up early again. Can you get back that lost sleep? Unfortunately, this is one of those myths. Sleep is not like the bank in the sense that you can't accumulate a debt and then hope to pay it off at a later point in time. And let me give you the evidence to make that point very clear. If I were to take an individual and deprive them of a whole night of sleep, 8 hours of lost sleep, and then I give them all of the recovery sleep that they want on a second night or a third night, yes, we see that they sleep longer. They try to sleep it off, as it were. But do they get back all of that 8 hours that they've lost? And the answer is no. Even if we keep measuring them, they never get back that sleep that they lost. So you cannot accumulate a debt and then hope to pay it off at a later point in time. And many of us do this in society. We're short sleeping during the week and then we binge with our sleep at the weekend. It's what we call social jet lag, or what I sometimes describe as sleep bulimia. It's this binge purge sort of profile. Now, there was a recent study, a very interesting study, where they looked at the mortality risk of short sleep. And firstly, what they found is a quite shocking result. Those people who are sleeping 5 hours a night have a 65% higher likelihood of dying at any time, increase of 65% in terms of mortality risk. However, if you get another group of people who are short sleeping, maybe just 5 or 6 hours a night during the week, but then sleep a little longer at the weekend, you can actually reduce some of that mortality risk. But there's a danger here. We know that that sort of social jet lag, binging at the weekend, short sleeping during the week, is associated not necessarily with a shorter life, but it's associated with a far less healthy life. You're far more likely to suffer from diabetes, to be obese, to have poor cardiovascular health and have cardiovascular outcomes. And if you look at that study, even though some people were trying to sleep back at the weekend some of that which they'd lost during the week, they were almost twice as likely to report being in very poor health relative to people who do what we generally recommend, which is consistently get good 7 to 9 hours of sleep every day, both during the week and the weekend. So the recommendation right now is to get consistent sleep, whether it's the weekend or the weekday. Keep doing that consistently. Unfortunately, sleep is not like a credit system, not that you would wish for, unfortunately. Should you use a snooze button? Well, certainly what I've said before is that regularity is critical, going to bed at the same time and waking up at the same time. And certainly using alarms can help you do that. And I use the word plural there, alarms. What I mean is not to have multiple awakenings in the morning. I mean, we should all set a to-bed alarm. You know, think about the time that you need to go to bed to get that 8-hour sleep opportunity, and then set the alarm maybe sort of 15 minutes before. And that's just the call. It's sort of like last orders at a bar. Now is the time to sort of start preparing to get ready for this sleep event. You can also, by the way, just sort of before sleep in the last hour, you can sort of get into your pajamas, your sleeping clothes, brush your teeth, floss your teeth, do all of those things that end up taking away a sort of an additional 15 minutes or 20 minutes. Get those in ahead of time. But what about the snooze button though? Unfortunately, it's probably not a good idea, because there is some data that I discuss in the book where if you look at the cardiovascular response to an alarm, it's actually quite a stressful event for your cardiovascular system. We see a spike in heart rate, stress chemicals increase. Now, it's fine to use an alarm just that one time in the morning to wake you up, but you shouldn't really be hitting the snooze button because then you are repeatedly assaulting your cardiovascular system. And you may think, well, I only hit it maybe sort of 3 or 4 times, how bad is that? Well, maybe for that one day it's not bad, but if you're doing that every single day, every week, every month, every year, every decade, across a lifetime, you can imagine the type of additional cardiovascular strain that places on people. So use the alarm, that's fine, but try to use it once and then get up and have a good day.
Just like we have general hygiene to help keep us healthy and safe from germs and disease, we have sleep hygiene strategies that can help us get good sleep every night. These are all ways to improve sleep without the use of medications, and everyone can benefit from these tips. It's important to maintain regular sleep schedules, which means waking up and going to bed at the same time every night and making sure to get at least 8 hours of sleep. Having a calm bedroom setting can help us sleep easier, so we should sleep in a quiet, dark, and comfortable environment. We should avoid spending time in bed if we are awake, and this is because by only using your bed for sleep, it can help make the brain associate being in bed with sleep, and therefore it can help you fall asleep easier. We should decrease nicotine, caffeine, and alcohol because these can interfere with sleep. It's also very important to exercise regularly, but not too close to bedtime. Usually earlier in the day is better. Having a warm beverage such as chamomile tea before bed can help calm us to prepare us for bed. And avoiding watching the clock can be helpful because checking the time repeatedly can make sleep anxiety worse for some people. And although it's hard, we should stay away from bright screens such as TV, cell phones, and tablets before bed. A better strategy would be reading a book. And lastly, practicing meditation and mindfulness before bedtime is another good way to calm the mind and prepare for bedtime. There are many different sleep disorders, such as sleep apnea, narcolepsy, and restless leg syndrome, but the one that most people are most familiar with and that we'll be focusing on today is insomnia. Insomnia is a very common sleep disorder that's characterized by difficulty falling asleep, staying asleep, waking up too early, or not feeling refreshed after sleeping. If it takes you more than 30 minutes to fall asleep, this is known as sleep onset insomnia. And if you wake up either too early or in the middle of the night for more than 30 minutes without being able to get back to sleep, this is called sleep maintenance insomnia. There are also different categories of insomnia based on how long the symptoms last. Transient insomnia is for several days. Short-term insomnia is for less than 3 months. And chronic insomnia is having symptoms at least 3 nights per week for at least 3 months. Insomnia can occur without reason, but there are also some things that can contribute to insomnia or make it worse. These are things such as stress, anxiety, PTSD, and depression, changes to your surrounding or schedules, napping excessively during the day, sleeping in noisy or bright environments, having chronic pain such as arthritis, also pregnancy, and certain medications and substances can also contribute to insomnia. There are many medications that can cause insomnia, but these are the ones that are most likely to. SSRIs or SNRIs, such as fluoxetine, bronchodilators, such as albuterol, CNS stimulants, such as Adderall or Ritalin, corticosteroids, such as prednisolone or methylprednisolone, decongestants, such as pseudoephedrine or phenylephrine, and also alcohol, caffeine, and nicotine. Our next section is going to focus on the medications used to treat insomnia, but first we're going to talk about the neurotransmitters, or the brain chemicals, that play a role in both sleep and the medications. We will group these brain chemicals based on if they cause more sleepiness and drowsiness, or if they cause you to be more awake and prevent sleep. Melatonin is a hormone that promotes sleep by regulating the circadian rhythm, which is the body's internal clock. Levels of melatonin increase when it's dark outside, so being exposed to light at nighttime can block melatonin production and prevent us from sleeping well. This is why it's so important to sleep in the dark and why it's good to avoid watching TV, using your phone, or any electronic device that has a screen before bedtime. We've talked about the role of serotonin for mood in medications such as antidepressants, but serotonin also has a role in sleep. Serotonin affects the quality of sleep, which is how long and how well you sleep. And also, in the body, serotonin is converted into melatonin. So we don't only need serotonin independently for its role in sleep, but also because we want to increase the amount of melatonin in our bodies. Adenosine increases a person's need for sleep, which is also called the sleep drive or sleep pressure. The sleep drive helps the body maintain its sleep-wake balance. For example, if you are deprived of sleep, the sleep drive makes you sleep more intensely and for a longer period of time the next time you fall asleep. The longer you stay awake, the stronger your sleep drive becomes because adenosine is building up in your body. And then when you actually fall asleep, the levels of adenosine decrease and clear out so that by the time you've gotten enough sleep in the morning, your sleep drive is low. You should also know that caffeine blocks adenosine, which is why you should avoid caffeine because it makes us more awake. GABA slows down the brain in order to make you calm enough to fall asleep. Sometimes, if you're too overwhelmed, it makes it hard to sleep because there's a lot going on in your brain. Now for the brain chemicals that prevent sleepiness. We've talked about norepinephrine before. This is the brain chemical that helps alert the body and is responsible for the fight or flight response. For example, it causes increased blood pressure, heart rate, and breathing in response to a stimuli. Norepinephrine can be thought of as adrenaline, and adrenaline is not something you want to increase if you are trying to fall asleep. Acetylcholine helps to regulate the natural sleep cycle. It's strongest during wakefulness and during REM. Acetylcholine helps with learning, and while you're awake, it helps the brain gather information, and then once you fall asleep, it helps the brain keep and remember that information. So this is why if you learn new information in the hours before bedtime, sleeping on it can help you remember it better. Histamine helps activate the brain. You may have heard of a class of medications called antihistamines, which are usually used in allergy. These medications reduce the amount of histamine in the body and therefore can make you sleepy. Dopamine helps stimulate the brain as well, and therefore it makes you more alert. Orexin, which is also known as hypocretin, is another brain chemical that keeps you awake and prevents the deep levels of sleep that we see in REM. Here are the different classes of medications that we can use to treat insomnia. We'll go through these one by one. There are two classes of medications that act on the benzodiazepine receptors, benzodiazepines themselves, and another class known as the Z drugs. Overall, Z drugs seem to be the safer and better option to use for insomnia because they're less likely to be misused, they help increase the total sleep time, and they have less withdrawal, tolerance, and rebound insomnia. But you should know that a potential side effect of these Z drugs are sleepwalking, sleep talking, sleep driving, and even sleep eating. Some side effects to be aware of with both of these classes are that they can cause dizziness and confusion and can increase the risk of falling. This is why they should be avoided in elderly patients and they should not be mixed with alcohol. You should also know that you should never abruptly discontinue these medications because this increases the risk of withdrawal symptoms, most notably possible seizures. Like I said before, both of these classes of medications work on the same receptor, which is the GABA A receptor. But the reason why we see different effects between these two classes is because they attach to that receptor in slightly different areas, as we can see in this picture. Overall, when the GABA A receptor is activated, there are 4 possible effects: promotion of sleep, reduction of anxiety, reduction of seizures, or muscle relaxation. These effects all have to do with where the medications attach to the receptors, and compared to the benzodiazepines, the Z drugs attach to the area that is responsible for the sedative, hypnotic, or sleep effects, and not so much the other ones. So this is why they are better for sleep in the sense that they don't cause the other 3 effects. And you can see why these drugs are called Z drugs, because they all have Z in their name. The benzodiazepines, you can remember, all end in PAM. There are a couple of medications that are available over the counter, or OTC, and this means that they can be used without prescriptions. These are diphenhydramine, also known as Benadryl, and doxylamine, also known as Unisom. These medications belong to a class called antihistamines, which, as I mentioned before, are sometimes used to treat allergic reactions as well. Since these medications have anticholinergic effects, which means they can cause dry mouth, urinary retention, constipation, as well as trouble thinking clearly and increased risk of falls, they should be avoided in elderly patients. These aren't great for long-term use because you can quickly build up a tolerance to them, which means they don't work as well as they once did. So these are good for people with mild, transient, or short-term insomnia. Next, we have a class of medications that are somewhat new. These are called the DORAs, which stands for dual orexin receptor antagonists. These are medications such as suvorexant, lemborexant, and daridexaran. Remember earlier we said that orexin is a brain chemical that causes wakefulness. So if we block it, it promotes sleepiness. Melatonin should sound familiar because we discussed it in the brain chemical chart on the drowsiness side. Melatonin is a hormone that's responsible for regulating our internal clock, the circadian rhythm. Melatonin is available OTC, but there is a prescription form called Ramelteon that's also available. These are good because they're less likely to be misused and because they are thought of as more of a natural product, since melatonin is something that our bodies produce naturally. One thing you should know is that they may cause extremely vivid dreams. And finally, we have antidepressants. Trazodone acts through changing the levels of serotonin. It has a really long half-life, which means it lasts for a long time in the body. So it's really good for sleep maintenance, but it also means that sometimes people will still feel sleepy in the morning. It can also lower blood pressure a little bit, so sometimes people feel dizzy if they stand up too quickly. Next, we have an antidepressant called doxepin, which is a tricyclic antidepressant. Its main mechanism of action in sleep is through blocking histamine and through increasing serotonin. Unfortunately, it also increases norepinephrine, which is one of the brain chemicals that causes wakefulness. But luckily, of all the TCAs, doxepin has the most antihistamine action, so this helps push the balance more towards causing sleepiness. This completes today's video on insomnia and sleep medications. So let's go through a couple of questions to review everything we've learned. True or false? NREM stage 1 is when deep sleep occurs. A, true. B, false. The answer is false. NREM stage 1 is very light sleep. NREM stage 3 is the deepest NREM sleep. Which of the following are good sleep hygiene tips? A, maintain regular sleep schedules. B, avoid bright screens before bedtime. C, sleep in a dark and quiet room. Or D, all of the above. The correct answer is D, all of the above. Which of the following is true regarding the impact of sleep on health? A, sleep only affects mental health. B, less sleep is better for health. C, getting adequate sleep helps with emotional control. Or D, sleep does not impact physical health. The correct answer is C. Getting adequate sleep helps with emotional control. Which of the following medications is most likely to worsen insomnia? A. Antihistamines, B. CNS stimulants, C. Z drugs, or D. Melatonin? The correct answer is B. CNS stimulants, and these are medications such as Adderall and Ritalin. Which of the following is an antidepressant that is commonly used for sleep? A. Trazodone, B. Diphenhydramine, C. Melatonin, or D. Suvorexant? The correct answer is A. Trazodone. Trazodone is a serotonin modulating antidepressant. Thank you for joining me today. If you have any questions on sleep, insomnia, or any of the medications, please contact your physician or pharmacist. Thank you. Have a great day.